Hey guys, how you doing? What's going on, brothers? Hey, welcome to this week's talk that we have, guys, of Old Gold Table Talk. We're going to get around this table and we're going to have a conversation tonight. I'm telling you now, if you want to go ahead and tag another brother, you might want to do that now. Because even if they don't want to talk about it, they need to talk about it. And we're going to talk about it right now, guys, on Old Gold Table Talk. This is Brother Terrence Hawkins, guys, here with you. I got an awesome guest today. We got an awesome brother on today, guys. And we're going to talk about how to maintain and enhance healthy libido. And we're going to do that with Dr. Dana Cooper. We're coming right back at you with Mr. Cooper and Old Gold Table Talk. Let's do it. All right. We are back here live, guys. I got the awesome brother Dana Cooper, guys. Dr. Dana Cooper, I must say, guys. And we are excited, Brother Cooper. We're excited to have you here on Old Gold Table Talk to sit around the table with us. Oh, man, we are excited. And I'm going to tell you, I got a pen, Doc. I got a pen and I'm ready. I got a pen and I'm ready. For those that are listening, guys, we'll go ahead and tell you right now, we'll say it out you throughout the program, though. If you have any questions for Dr. Cooper, I want you to make sure that you go ahead and chat it into the chat field there, and we'll pop it up, and he can answer some questions, as well. And we got an awesome Cooper. Before we get into the meat of the talk, okay? If the brothers don't know you, tell the brothers, just introduce yourself to the brothers first, because you're going to talk about something. You're going to talk about something that a lot of us want you to talk about, but we want to actually make sure, guys, who are we going to hear this information from, sir?
Excellent. Well, first of all, thank you so much for hosting and having me on here. I look forward to sharing some insightful but practical information. Like Brother Hawkins said, I'm Dr. Dana Cooper. I pledged spring 14 at Florida A&M University. That's the Beta Nu chapter. And I'm really excited to be here. I also practice here in Charlotte as well. And I just look forward to just sharing some information with you guys.
Awesome. Well, we want the information. We want the information. And Doc, I'm gonna tell you, we get deep over here, all right? We're gonna get deep. We are sitting around the table. We are sitting around the table, and what the brothers actually want to do, we're going to talk about it and stuff. And when you was actually telling me and stuff, about your service and what you do, and I got the newsletter that you had, and you was talking about libido. And I was like, conversation piece, all right? Because as growing up, honestly, I wasn't taught a lot about that growing up, or what's going to happen when you get older. Something's going to happen, right? Tell us what's going on in your body. I just want to start off with that's the educational part about this. Tell us what's going on.
Excellent. Yes, absolutely. And it doesn't have to start as you don't have to be old or seasoned for these things to start. A major portion of our livelihood is to be able to function in the bedroom, to be able to want to function in the bedroom. If we lose that quality of life, we have to resort to things a lot of times we don't want to have to do. And sometimes we give up. But frankly, there's a lot of options out there holistically that we can galvanize to make sure we maintain our member for a longer period of time.
That's one point. And we're going to cover some of that, right? We're going to cover some of that. We're doing rooted to the tutor. That's what we're going to be doing. That's what we're going to be doing actually right now. One of the first thing I want you to actually explain and stuff, and we actually talked before and stuff, and actually looking at this right here, libido versus arousal. Talk about it for us.
Yes, absolutely. And so a lot of times we think of libido and arousal as the very same thing. And there are some differences between the two. First, we have to understand what the primary difference is with libido versus arousal. Libido is really defined as your overall desire for sexual activity and intercourse. That's libido. So it's based on desire. When we think about arousal, arousal has more to do with your physical ability, your psychological ability to gain and maintain and prepare for intercourse. And a lot of
Mm.
times, you can have one without the other, and one could be failing you, and the other one could be maintained very well. And so, knowing the difference between the two is very crucial. And there are some ways that you can know the difference between the two. One telltale sign that we like to know how we're doing as relates to our general sexual function and general health is
We don't ask our spouse. She said, "How you?" I mean, my fault. Go ahead. Go ahead.
one thing you got to think about is, when was the last time and how often do you have morning erections?
Mm.
And as tongue in cheek as it is, morning erections is a pretty good sign of general sexual function. Now, it doesn't mean that if you're not getting them, everything is broken, but it does let you know where you are in that spectrum, as relates to either high libido, low libido, or high arousal, low arousal.
Man, wow, wow, wow. This is great. Is this information good for the younger brother? They're saying that, hey, we ain't worried about that. I'm good. Is this good for the younger brother?
It
And why,
absolutely
why
is.
should the younger brother actually listen to actually this right now? Because you don't say some key points already. You know what I'm
Mhm.
saying? For them stuff. Because some of them are actually thinking, what do you mean? This is never going to happen to me. I'm never even going to worry about this. Talk a little bit about that, sir.
Yep, absolutely. And so it defies age, because, if we're thinking about the actual, physical well-being of arousal, it doesn't have to be just physical. It could be libido. There could be many things that are stopping your process, psychosocial. There could be many things, as far as stress level. There could be many things as far as satisfaction or dissatisfaction that could be affecting you right now. And you
Mm,
may think that you have a healthy libido or arousal, but there's a great chance that it could be much improved and or enhanced at
okay.
any age.
Okay. Well, let's get all deep into it. I'm gonna throw it out there. I mean, we around the table, so I'm gonna
Get
throw
this
it out there at you with you, right? Here's a question we talked about, guys. What's making it hard to be hard?
right.
Let's go to it. Let's talk about it, right?
So that's a really good question. There's several things that could be affecting your quality of erection, that could be
Okay.
affecting your quality of your actual libido and sex drive. Some of those most commonly known things are cardiovascular diseases, and I'll tell you exactly why.
Okay.
So things like long-term hypertension, things like long-term diabetes, most of us know they do have an effect on our heart. What a lot of us don't know is that our heart is a muscle just like the other muscles in our body, and our heart requires blood flow. If you're a person who deals with issues with circulation and blood flow, then this could be a part of what's making it hard for you to maintain your member well. Okay, so that's one of the things. Maybe some cardiovascular or other conditions that affect blood flow. Some of the other things may be actual spine health. I've seen many patients in my practice who have dealt with spinal or spine related issues like nerve damage. And maybe they didn't notice it was nerve damage. Maybe they noticed they were getting a lot of pins and needles or numbness and tingling, which runs right along that line with lack of sensation. And so, if you're dealing with anything like that, there's a chance that it could be affecting your member, or there's a chance that you can have a major improvement if you have less spine issues. Okay. And then another thing would be general dissatisfaction with what you're doing, who you're doing it with, how you're doing it. These things play a major factor in the psychosocial end of maintaining what you're doing as far as libido. And so I've had many patients who said, "Hey doc, my back is doing a little bit better, but man, I got to tell you, I noticed something. I woke up different today, or last night I maintained different, and my sensation, I didn't realize that I was losing it until I regained it." And so I've had a lot of
Mm.
people who had spine related issues and didn't notice it. And there's two more things I want to kind of drop in
Okay.
your billfold there. Drinking and smoking marijuana. Okay,
Okay.
and a lot of us know a lot about this, but drinking a lot of times what it does is it relaxes us. Okay, it does a really good job of relaxing us. However, not so good of a job as relates to long-term use and how it can affect your blood flow and circulation. And so, decreasing how much drinking we do could be a major improvement. Smoking marijuana has been known for decreasing stamina, and a lot of us, a lot of us are involved in this, in this recreational activity, but it is well researched and proven that it has a major impact on your stamina from a negative end.
Now you mentioned something actually real quick, all right, and I'm gonna actually go through several different things. Okay, 'cause I told you I'm taking notes. All right, I'm taking notes. Right, you're talking about the blood flow and and stuff like that, and you're talking about somebody high blood pressure. How does that medication, or does the medication even help that, or hurt that, or what?
Well, it sure does. As a matter of fact, the medications that we do take as relates to arousal, they do work. In fact,
But how about the
the
blood pressure medication? What is that doing to you for blood pressure specifically, or is it
So
doing
what the
anything?
blood pressure medication
Yeah.
does, if it's a vasodilating blood pressure, meaning it relaxes your blood vessels, what it
Mhm.
does is it simply opens up your blood vessels and makes that circulation easier. And so
Okay.
that circulation that needs to get around to your blood vessels and decrease your blood pressure also gets to your end organ, and it helps your erectile function as well.
Oh, okay, okay. Now
Mhm.
you mentioned drinking. Now, back in school in college,
Mhm.
our college days, right? Right. Back in the college days, they used to talk about several different alcohols, and gin make you sin and everything else is going on. But you just said that drinking can affect this. Now, did you say long term? Is that what the key was,
Absolutely. So
or
this
what's
is
going on?
absolutely, this is more on the long term end as relates to how it affects your cardiovascular system. So it's really more of a secondary effect. But if we're talking primary or the initial effects, a lot of us are well aware of a term called whiskey penis. I'll call it
Huh?
that, where we've overindulged to the place where we've actually lost some of our satisfaction. And so this is another area where it can decrease your performance in the bedroom on the
Mm,
short term.
short term, it's sloppy drunk. This
That's right.
That's what they said. Stop. Well, is there a difference? Let's talk about men's and women.
There's a huge difference. We hear Venus versus Mars. I honor that's a very real thing. Okay. What drives men typically for sexual desire and for libido is vastly different from what typically drives women. And it's based on our actual hormone makeup. Us as men, we have hormones that respond directly to stress, believe it or not, and competition. There's a hormone in our body, a couple hormones in our body called vasopressin and testosterone that strive off of this or drive off of these stressful situations and actually can enhance our sexual aptitude and our libido. Women are very different. Any of you who may have the experience may notice that most commonly women are driven the opposite direction by their stress. What that means is the hormones in their body that responds to stress, which is oxytocin, is decreased whenever they're in a stressful situation, trying to overcome work, trying to overcome situations, maybe even with ourselves. These will directly block what they need to be aroused. So, um, Whining and dining has its place 100%, and having a de-stressed environment for women has proven to not only increase their libido but also increase their vaginal moisture and decrease dryness.
So you said De-stress.
That's right.
So we stop stressing out the wise is what you try to say. Hey, I'm gonna write that down, put it, I'll put a little star by there. Right? That actually does that. Go ahead.
But that's
Okay.
yeah. So that's right. When we're trying to understand, there's a balance between the two. What motivates you may not motivate your partner, just based on our actual chemistry.
Okay. Okay. Brothers, we are talking to Brother Dr. Dana Cooper. He is having an awesome conversation. If you just actually tuned in for us, we are talking about, guys, how to maintain and enhance healthy libido. Okay. That's our conversation around the table today. We have an awesome conversation. So let's continue. Talk a little bit then about, there's a lot of things that's online and a lot of things that's come on the TV, and we got different color pills now and stuff like that, right? That's going on.
Mhm.
Do drugs really work, and how do they work?
Absolutely. In fact, the first male enhancement drug was a mistake.
Oh,
It
wow.
was made as like we mentioned earlier, actually a blood vessel relaxing drug. It was a blood pressure medicine. And during the clinical trials of this blood pressure medicine, they noticed a lot of the volunteers were having unprovoked or involuntary long-term erections,
Mm,
which was a complete accident for the case. But what they identified was that, the drugs that they were using for blood pressure were enhancing their erections. And not only were they enhancing their erections, these were unprovoked erections, meaning these gentlemen did not do anything to gain these erections. And so they just found the gift. And this is something that they identified in that study. So absolutely, there are drugs that work. Okay. Now, this first drug was through Pfizer, and it is now known as Viagra. Okay. So the first male enhancement drug was actually used for blood pressure. And it wasn't successful with blood pressure, but they found that it was fantastic with building unprovoked erections. Now, just like most things, this does not come without side effects. Okay. So there is a risk of things like headaches, dizziness, fainting episodes. And a lot of these are especially present when there's other medicines that we're using in our system. So if you're a person who's on other medications and you're using this thing, there's a chance that you may end your night off in a way that you probably did not want to. And I'm pretty sure we want to finish, a night pretty well with our partners, with the knowledge that, hey, I'm not at risk of any side effects that go along with this.
okay. So what about, because you actually mentioned that the combination of other things, and you mentioned blood pressure. Sometimes, if somebody's on blood pressure, then
Mhm.
you actually help them. And if they're taking, Viagra, let's say, all right, from
Mhm.
Pfizer. So Pfizer did do something good. So let's say Pfizer right now. So if they're taking that, what kind of, side effects that may happen? Was that dangerous? Is good? What about that?
Yeah, so these are I would consider these to be dangerous side effects, because a lot of times we have side effects. What do? We go to other over-the-counter medicines. And so let's say you have a headache and you don't realize that you're having a headache from, having Viagra alone, and you mix it with the other medicines that you have. And now you've got the effect of the Viagra itself, and now you're mixing two symptoms and side effects together, and before you know it, you're in the emergency room. So it is dangerous when we're living this life and we're kind of living on the edge of side effect to side effect, and covering them up. And so dizziness, people have had syncopal episodes, which means they fainted. And these are very, very dangerous risks to encounter.
Wow, 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 wow. Good stuff. Good stuff. Brothers, if you have any questions, just leave me in the comments. Let's go to the comments part, and I can ask actually Dr. Cooper, the question that you have, all right? If you have that. So we talked about actually drugs. A lot of people, of course, don't want to do a lot of drugs, right?
Mhm.
Want to do drugs, want to play. Is there any type of natural things that we can do to either slow this process down, help this process, whatever? What can we do?
Without a doubt. So there are numerous things that could be done naturally that will benefit, us as relates to libido, as relates to erectile function and enhancement. There's many things that we can do, and many of these things have much less side effects. Okay, and so that's the most important thing that I want to kind of tell you there is that a lot of them have much less side effects. The number one thing is chiropractic care. As I mentioned before, I've had many patients who have noticed a major improvement in their stamina, in their erectile function, in their sensation. They felt like their life had started again with their partner, and they became very, very not only satisfied, but anticipating sexual encounters with their partner again. Another thing is diet. Diet is a major portion of these things, because if we're thinking about, things like cardiovascular diseases, all sorts of other things that can affect our blood circulation, we have to consider diet, because when we eat foods, our foods have a direct effect on our arteries. If we're eating foods that are high in grease, eating foods that are high in unhealthy fats, eating foods that are high in sugar, that can affect your actual cardiovascular system and indirectly cause erectile dysfunction. There are other things, if we're talking about supplements, supplements can be fantastic. They can have much less side effects than the medicines. I call it the 3 G's. Okay.
Right.
Ginger, garlic, and ginseng. Ginger, garlic, and ginseng. These are all what's called vasodilating natural herbs. These are natural herbs that you can get and may already have them in your kitchen. And you can find yourself with much of the benefits of doing a Viagra with less of the side effects. And along the way, you may find that you've got long-term benefits from doing these things, like ginseng and garlic are antivirals. And so you get a double whammy in a sense. So you're doing the garlic and ginger for, erectile function, but it's antiviral. So it can help you during a time like this, but it's also good for your blood pressure and blood sugar. Okay. So it's really good to galvanize on natural things that can give you a benefit for your total health and total well-being. I'll give you a couple more.
That do you have to take, though, when you talk about the natural? Because we are heard, that if it's not in the soil, it's not in the food, not in the food, it's not in you, and stuff like that, and the supplements, all that. And you said, so how much of that do we really have to take for it to even make a difference?
That's a fantastic question. So if you think of the purpose of natural herbs, or you think about how natural supplements are grown, initially, a lot of these supplements, a lot of these herbs, when they were grown, we only plucked 1 or 2 a day. And now when we think about foods, how they're manufactured now, we have such a large supply of these foods, and it's for a reason. When you think about drugs, Western drugs are made to act faster. They're made to act longer. Okay. And so those 2 ideas alone come with side effects. If they're supposed to act faster and act longer, that means they're a lot more likely to give you side effects, a lot more likely. Now, when you think of herbs, you're going to have to do more of them. And it's as simple as that. You have to do more of them because they're a natural supplement. They're not meant to, come with a great deal of side effects. So if I were to do ginger, for instance, for the purpose that we're discussing, I would make a ginger tea for myself once a day. I would make it by cutting the root in slices and boiling it. I wouldn't go to the store and get a pack. I would boil it myself. I would slice it, boil it, and I would retain that as a tea, and I would drink it daily. That alone, you'll see improvements with erectile function, longevity, as well as cardiovascular health itself.
Man, you gonna have all the brothers getting up in the morning going to get some ginger.
As they should, as they should.
They gonna get up and go and get the brothers. How many of y'all gonna get up and go out to get that tea? Let's tell the truth, right? You can comment on that. We do have another a question actually real quick. We can ask you a quiet question. We got to ask you a question. Ask your format what we're here real quick. How does, because you mentioned chiropractic, okay? And they want to actually know, how does chiropractic care enhance libido?
Yes, absolutely. And so, once again, if we're talking about libido, libido deals directly with sexual desire. Okay. A lot of our desire has to do with our last encounter. If our last encounter was lack of sensation, displeasure, not really satisfied, or if we're scarred by the fact that maybe our arousal is not what it used to be, chiropractic comes in because our goal as chiropractors is to alleviate any blockage that you may have in your nervous system. Your spine works directly with your nervous system. If you've got disc herniations, if you've got imbalances, it doesn't even have to be in your disc. It could be in your muscles. If you've got these imbalances and you've got pain, if you have numbness, if you've got tenderness or tingling, these things can severely diminish your sensation and your ability to gain and maintain erections. And so our goal is twofold. Our goal is, one, to help you maintain your total functioning with your spine and your nervous system. And then two, the goal is to see those things build a pattern of sexual habits, healthy sexual habits in the future.
Awesome, awesome, awesome. We got a comment actually from one of the brothers actually here. It's kind of cool. He said, oddly enough, my wife makes ginger tea regularly. Maybe she needs Zeus. I would say that to your brother. I said, brother, I said, just don't stress her out, right? So we need some ginger tea
She knows
and
what
not
she's doing.
stress out the spouse. That's the combination we need, right?
That's right. That's right. There you go.
But this has been awesome. This has been awesome. And I don't see no more comments at this particular time. Give us some last minute thoughts that you have. We talked about a lot of stuff, and we're definitely going to have you on. And I know the brothers are going to see you around the actual brotherhood socials and everything else like that. But tell us actually real quick some last minute things that you want us to know about this subject, please.
Absolutely. And so there's a couple more things that you can do naturally. I'm gonna give you those things. Exercise absolutely has its place. You know, the healthier host, the better your member will be. So the healthier you strive to be as far as your cardiovascular health, that's going to help you gain and maintain erectile function very well. So exercise has its place. Believe it or not, being around other young males has been linked with increased testosterone. And a lot of
Wow.
us, yes, absolutely. A lot of us have no idea, but being around other young males will increase your testosterone, which will indirectly, once again, give you a boost in your libido, okay, which is your sex drive. There's been some studies. I'll do you one further. There's been some studies, since 2009 that found that babysitting could hurt your testosterone.
All right. All right.
Uh-huh. And this is coming from a new dad, so it's okay.
I knew that.
Babysitting alone can decrease your testosterone. They found that just holding a baby for a certain amount of time will decrease your testosterone. And I'm not saying drop the babies. What I'm saying is spend a little more times with the good brothers.
Wow, that's all. We have a couple more questions that's actually
Mhm.
popped up and stuff, and brothers, keep actually your questions up. He's here to answer these questions that you have also as well. But here's a question: does fatty tissue on the spine decrease libido? Asking for a friend. All right, go ahead.
So fatty tissue itself, no, it does not. Not as relates to libido. But if we're thinking about arousal, meaning your physical ability to gain and maintain a firm erection, the more fat that you have typically will coincide with how well your heart is going to be able to pump blood to your member. So the healthier you are as relates to, less fat tissue, the better your heart will do its job in getting blood flow to your member.
Awesome, awesome. Have another one here for you. Another one here for you. Okay, what role does organic honey play in men's libido?
So organic honey is fantastic. As a matter of fact, you should be adding that to your ginger. Okay. Organic honey is a major factor because it's also antiviral. It's also antihistamine. So it's anti a lot of things that are really really bad for your overall health. Some say organic honey is a natural aphrodisiac as well, and so that may be something that you can share with your partner that will also benefit her sex drive as well.
This has been awesome. If the brothers need to contact you, if they need to contact you, so what's the number that they can actually contact you on if they need to contact you?
Yes. And so if you're looking for support with some of these things, I provide 100% chiropractic care here in the Charlotte region. I have a physical clinic and location. Our clinic has just been honored as the best practice in Greater Cabarrus. You can find us at the phone number, which is 980-248-1788. It's 980-248-1788. Excellent. It's right up there. And if you're looking for somebody who can help you treat with your total spine, but who can also help you with functional health, some of these functional health topics, like long-term quality of life, long-term functioning, that's what we do at our practice.
Awesome. Awesome, guys. Awesome. Guys, look him up, give him a phone call. Thank you again, Doc, for actually coming on Old Gold Table Talk, to come around the table, to talk around the table. I want you to hang on actually for a minute, there stuff. So don't actually go anywhere there. Oh, somebody's asking about your name.
Oh, the practice name is Balanced Chiropractic. Balance is spelled with a D at the end. Balanced Chiropractic.
There you go. There you go. All right. All right. Again, actually, thank you for actually coming out with us. Hang on actually with us, brother. This has been another episode of Old Gold Table Talk, guys. Thank you. Be with us next a month, guys. We're going to we'll get into a little bit more, a little real estate. All right. A little real estate. So any of you thinking about real estate, investing and all that, come back to us on next month. This is T-Hawk and I'm out. Have a great day, guys. Take care.